One.
Hi, my name is Margaret. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Haley Pappas, June 19th, 2001.
Okay, this matches the patient armband, so this is a correct patient and they're alert and engaged. Okay, can you please tell me where you are?
Doctor's office,
Can you tell me today's date?
October 29th.
Yes. And what brings you in today?
Checkup.
Okay, the patient is oriented to person, time, place, and situation. I'm going to perform a focused assessment on you today. It should take between 5 and 8 minutes. I'm going to explain everything I'm going to do as I go along. Please let me know if you have any questions or if you feel uncomfortable.
Okay.
The patient understands the purpose of this exam and is comfortable. Okay. So have you been experiencing frequent headaches?
No.
Are you experiencing any muscle weakness, numbness, or tingling?
No.
Are you having any problems moving around?
No.
And have you experienced a loss of consciousness, fainted, or felt like you were not aware of your situation?
No.
Okay, so the patient denies any neuromuscular complaints. If the patient reported concerns, I would further assess using Old Cart's ice. So the patient responds appropriately to the questions, the speech is coherent, and the speech is at the appropriate volume and displays variation in tone. Her voice is clear and free of stuttering. Okay, can you please stand and then walk to the end of the rug and then back to me? Okay, and then go ahead and have a seat again. The patient maintained upright posture and balance while walking around with opposing arm swing. Next, I'm gonna perform a few tests, so please just follow my directions. Your pupils, okay, the corneal light reflection is the same, is at the same location bilaterally. Now I'm going to have you focus behind me. I'm going to shine my pen light, so don't look directly in the light, and just keep your eyes focused on. Okay, the pupils are equal and round. Pupils react to light with both direct and consensual responses. Please continue to stare at that point behind me, and then shift your eyes to focus on the tip of my pen. And back again. Okay, the pupils accommodate to a nearby object. Now just keep your eyes focused on my pen as I move it. Follow it only with your eyes and not your head. Okay, this pen light, the patient's tracking is smooth and coordinated. All right, then can you please clench your jaw for me and grit your teeth? Okay, and the patient is able to perform movements as instructed. Please raise your eyebrows and then lower them. Close your eyes as tight as you can, and then purse your lips. And then puff out your cheeks like a fish, and then smile. Cute. Okay, the patient is able to perform movements as instructed. Excuse me. Okay, please open your mouth as you would say ah. Okay. There is symmetrical upper movement of the soft palate and uvula. Please shrug your shoulders and try to not yet. As I push down, try to push my hands back up. Okay, the patient is able to shrug her shoulders. The motion is smooth and equal bilaterally, and the strength is 5 out of 5. Can you stick your tongue out for me and move it side to side? And then up and down. Okay, the tongue is symmetrical and movement is smooth. Okay, so now I'm going to have you stand up and walk like you're doing a sobriety test, so like heel to toe,
Okay.
like this. There you go. Yeah. And just there and back is good. All right, the patient is, you can stand up, stay standing up or sit down, whatever. The patient is able to maintain balance and can walk and the foot position is maintained. Can you please stand with your feet together and your arms at your side and then close your eyes? Okay. The patient is upright and the balance position is maintained. And if I had any concerns for falling over, I'd be ready to catch her. Can you please stretch out your arms and close your eyes? And then touch your nose with your right index finger. And back out. And then your left. And back out. Okay, and then you can put your arms down and open your eyes. The patient is able to touch their nose using their index finger on alternate arms in a rhythmical manner. Now you're gonna lie down on our exam table, sort of. And then if you can drag one of your feet along the other leg all the way to your toes. Yeah. And then other one. Okay. You can sit up now. The patient can run her heel down the side of her opposing shin. Now I'm going to use my cotton ball and I'm going to touch various areas of your skin. So just point to wherever you feel me touch, and you can close your eyes. Okay. The patient identifies areas of touch correctly. Now I'm going to test your sensation of pressure. I've broken this Q-tip in half, so one end is slightly sharper, and then this is what you feel if it's sharp. You don't have to close your eyes yet. And this is what you're going to feel on the dull reflexes. So now I'm going to touch various places. Just let me know if you feel sharp or dull.
Dull. Sharp. Sharp. Dull.
Sharp!
Dull.
Okay, the patient identifies touch as sharp or dull appropriately. Now I'm going to be using my reflex hammer to gently tap on specific points of your arms and legs. So I'm going to just put all of your weight on here. There you go, and relax your arm as best you can. Okay, brachial reflex is equal at 2+, and then tricep reflex is equal to 2+, and then it's a little hard because your feet aren't dangling, but that's fine. Okay, it's fine. And the patellar reflex is also equal at 2+. Okay, and that's it. Good work.